Hi viewers, this is Dr. Muhammad Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on African horse sickness, which is also known as Perdisiecti, Pestitis equorum, La Peste equina, and Peste equina africana. It is a series often fatal disease that affects the members of Equidae family. The disease is spread by arthropod vectors, primarily culicoid species biting midges, with mortality in horses as high as 95%. So in this lecture, we'll discuss the African horse sickness, its etiology, species affected, and transmission. It will also cover the epidemiology of this disease, as well as the outline of the economic impact the disease has had in the past and could have in the future. Additionally, we'll overview the clinical signs and necropsy findings, as well as the diagnosis and treatment of the disease. Finally, we'll address the prevention and control measures for the disease, as well as the actions to take if African horse sickness is suspected. The African horse sickness virus can infect horses, donkeys, mules, zebras, camels, and dogs. The most serious infections occur in horses and mules, which appear to be accidental hosts. Zebras and donkeys rarely develop a serious clinical signs. Zebras, which are often asymptomatic, are thought to be natural reservoir hosts in the regions of Africa. Infections in camels have also been reported but appear to be uncommon and asymptomatic. Morbidity and mortality vary with the species of the animal, previous immunity, and the form of the disease. Horses are particularly susceptible to the more severe forms of African horse sickness. The mixed and pulmonary forms tend to predominate in susceptible horse populations, and the mortality rates is usually 50 to 95%. In other species of Equidae, African horse sickness is generally less severe. In mules, the mortality rate is approximately 50%, and in the European and Asian donkeys, 5 to 10%. The death is rare in African donkeys and zebra. Animals that recover from African horse sickness develop good immunity to infecting serotype and partial immunity to other serotypes. The African horse sickness is not a contagious disease, that is, it does not spread directly from horse to horse. The virus is transmitted by the arthropod vector culicoids biting midges. The principal vector species is Culicoides imicola. However, other culicoid species, which is common in many parts of the United States, should also be considered potential vectors. The viremia that develops in Equidae species is high enough to infect competent vectors. However, the length of viremia lasting 12 to 40 days in horses and up to 6 weeks in zebras and African donkeys. As just mentioned, there are 4 different manifestations of African horse sickness: the peracute pulmonary form, the subacute edematous or cardiac form, the acute mixed form, and horse sickness fever. The symptomatic infections occur most often in horses and mules. The mildest form, horse sickness fever, tends to be seen in the horses with partial immunity, mules and donkeys. This form can also occur in zebras, although most cases in this species are asymptomatic. The peracute or pulmonary form of the African horse sickness usually begins with an acute fever, followed by the sudden onset of the severe respiratory distress. Infected animals often stand with the forelegs spread, head extended, and nostrils fully dilated. Other clinical signs may include tachypnea, forced expiration, profuse sweating, spasmodic coughing, and frothy serofibrinous nasal exudate. Dyspnea usually progresses rapidly, and the animal often dies within a few hours after the respiratory signs appear. The subacute or cardiac form of the African horse sickness usually begins with a fever up to 106 degrees Fahrenheit that lasts for 3 to 6 days. Shortly before the fever starts to subside, edematous swellings appear in the supraorbital fossa or and eyelids. Swelling then spread to involve the cheeks, lips, tongue, intermandibular space, laryngeal region, and sometimes the neck, shoulder, and chest. If the animal recovers, the swellings gradually subside over the next 3 to 8 days. In the acute or mixed form of African horse sickness, the symptoms of both the pulmonary and the cardiac forms are seen. In most cases, cardiac form is subclinical and is followed by severe respiratory distress. Occasionally, mild respiratory signs may be followed by the edema and death from cardiac failure. The mixed form of African horse sickness is rarely diagnosed clinically, but it is seen often at the necropsy in horses and mules. The mortality rate for acute mixed form varies from about 70% to greater than 80%. In the pulmonary form of African horse sickness, interlobular edema of the lungs and hydrothorax are the characteristic lesions. In the most acute cases, the frothy fluid flows from the nostrils and the cut surface of the lungs, which are the mottled red, non collapsed, and heavy. The stomach mucosa may be hyperemic and edematous. Hyperemia and the petechial hemorrhages may also be apparent in the small and large intestines, and the pericardium may contain petechia. The African horse sickness should be suspected in equine demonstrating the previously mentioned clinical signs. Supraorbital swellings are particularly characteristic of this disease. Additionally, a history of prevalence or exposure to competent vectors or of the travel from the exotic area can be important factors. Vaccines have been developed for all 9 serotypes of the virus, but are not currently available in United States of America. If you suspect a case of African horse sickness or any outbreak, then contact your state or federal veterinarian immediately and quarantine the premises. If African horse sickness is detected in a non-endemic country, a strict quarantine zone should be established. Individual veterinarians who encounter a case of African horse sickness should follow the national or local guidelines for the disease reporting and diagnostic testing. The horses cannot enter the United States of America from an African horse sickness endemic country unless they have been in an African horse sickness free country or area of the world for at least 60 days. Vector control measures such as modifications of culicoids breeding areas in insect repellents and targeted applications of insecticides or larvicides may also be useful. Well, this is the end of our today's lecture. Thank you so much.